Hi, everyone. So I'll just introduce myself briefly because Julia did such a great job. So yes, my name is Sarah. I'm here to talk to you about scientific illustrations and scientific communications. And as Julia had mentioned, I have a research background, so a lot of the kind of concepts we're going to be talking about are evidence-based, which we always like to use, especially when we're talking about concepts like knowledge translation. But we're not an expert on everything. So if anyone has anything to add, I encourage you to join in on the chat, add any resources that you found that are helpful for your scientific illustration or communications methods, and things that relate to what we're talking about or would add value are definitely appreciated. And at the same tone, if you have questions or comments while I'm presenting, feel free to throw those into the chat. I'll try to monitor that as I'm talking. And we'd also be happy to take any questions at the end. So our contact information is at the bottom there as well. We're always happy to respond to people that have questions about a career in scientific illustrating or scientific communication, as well as we are currently hiring. I don't know if Natasha has put in a nice advertisement here, but we are currently hiring for scientific illustrators, both junior and senior illustrators. So if you know anyone or if yourself is talented in art and science and would like to try your hand at it, please send us an email. So yeah, we're going to get started with just talking a little bit about so I guess Julia did a land acknowledgement, but I'll also mention that I am currently in Halifax, Nova Scotia, whereas I know some of you may be joining us from different locations across Canada, so just keeping that in mind. So I'm gonna start off by talking about the science and practice of communication, and then Natasha will continue on. We're kind of doing a half and half presentation, but they very much go together. So we'll take questions collectively at the end. And for today, what we're going to be talking about is a little bit about why visual communication can be useful. And we'll try to frame a lot of our examples through knowledge translation and specifically talking with lay audiences. I'm going to tell you a little bit about Designs That Sell just to give you some information about our background, what we do, and what we're able to help clients with, and where our focuses are. And then we'll go into specific steps and resources that you can use to make effective scientific illustrations. When we talk about scientific illustrations, really we're like broadly talking about visual communication. And hello, Riza. I would love to see who's here. Feel free to introduce yourself in the chat. Tell us where you're joining in from. It's always nice to see people from all around, especially in Canada where we're so dispersed and COVID now. Okay, so yeah, we can move on, Natasha, and get started. All right, so first of all, what's the problem? What needs to be addressed? Obviously, as scientists, we need to communicate science in a number of different settings. So when we're talking about applying for grants or funding, more and more we're seeing that different funding agencies are asking at the time of when we're planning a research project, how we're going to be translating and disseminating that knowledge that we're obtaining through this research. So it's more important than ever to have a plan put in place as you're, from the get-go, as you're thinking about how you're going to be working through your research projects. In addition, scientific journals are, more and more seeking original figures. I've seen illustrated reviews being asked for. Graphical abstracts are becoming more commonplace. And as we know, as things are becoming more web-based, that those can be very useful tools. And then obviously when we talk about knowledge translation, there's a few different settings where it becomes really important, both within the clinical setting, but also when we talk about public health, as we've been seeing in this COVID pandemic. And Natasha will be able to speak to those specific examples in a little bit as well. So a lot of people from, we have some people from Alberta, Manitoba. It's great to meet you guys. And some others from Vancouver, West Coast joiners, and St. John. So what's our solution and how do we address this at Designs That Sell? When we think about visual science communication, we think about ways that we can essentially customize or brand science or brand scientific communication and findings through evidence-based visual communication strategies. So that's just really a fancy way of saying that we look at how communication is most efficacious in a visual form, and we apply that to knowledge translation or scientific communication. So on the right there, I'm sure some of you can recognize this and where it's branded from, but we are quick to recognize some journals, for example, Nature publications. We know what their science looks like, and that's because they've done a really great job of branding their science. And, not everyone's going to have in-house illustrators like Nature does, but there's easy ways that you can take their strategy of branding science or branding your own content and apply that to your own research and research projects. All right, so just some facts about why we use visuals. As many of you know, they're more memorable. I'm the person who can remember pictures and visuals of a paper more than I can remember names. It's also very useful for attracting audiences and readers. Obviously, this helps increase visibility of your science and research. And something that we don't usually think about is that having visual illustrations or visual abstracts can actually help clarify and fine tune ideas. And this becomes extremely important when you're trying to communicate to, let's say, a grant panel, or you're trying to communicate to the public who are not going to know all those small details about your research or why what you're communicating is important. You know, you can take all that text that you'd be putting in to try to explain these things and you can visualize them. And that can really help, obviously, when you're putting in grants that have word caps, but also when you want to quickly communicate across the board. Accessibility is another thing to think about. Not everyone's going to be able to understand language the same, but when you're using things like symbols, pictograms, or visuals, that becomes a lot more kind of cross-cultural as well as cross-language barrier. And the goal of all of this is to really reduce cognitive load. So to decrease the amount of time it takes to somebody to engage with some kind of concept, whether it's scientific or research-based, for them to be able to get what you're trying to put across as quickly as possible and without having to try to infer anything. So the information should be, available to them. And as we are scientists, many of us ourselves probably joining in here, we always like to talk about stats and data. So here's a few references and so just some fun facts that I like to point out. When we're talking about the average English adult sentence reading speed, it ends up being about 200 words per minute. In that same minute, your brain could have been processing 1,200 images. So you can see how, one image might be worth 1,000 words. It actually turns out that 200 words is about 1,200 images. So you can imagine how you can use visual communication to really amplify the amount of information you get across in a short amount of time. And this is an example of how we can apply that knowledge. So funny enough, this is actually a project done here for individuals in Halifax. So some of you might actually recognize this individual. This is for Robin Erkhart, who does some research on cancer survivorship and specifically wanted to take an abstract that was all text-based and turn it into something that was a graphical abstract.
Now's your chance. So I'm looking at HV Connects.
So I'm just waiting if somebody can mute themselves or some background noise
Teaching
here.
and Learning Day, 9 to 3 virtual. We're using.
Sorry about that. Okay, thank you. Yeah, no, it happens, virtual things. Yeah, so this, we took something that was really text heavy, something that would take somebody quite a bit of time and commitment to read through. And we turned it into something that was more digestible, broken apart, and really highlighted the main points of this research. So this was designed and communicated by a team of Natasha herself, who's going to be talking to you guys in a little bit, and Molly, who is one of our very talented illustrators. And what you can see here is that, when we're looking on the left and we're trying to digest that versus looking on the right, there are some key things that stand out. And we can also quickly head to the sections that we're interested in. And then when needed, we can go into the text to kind of get some more content. So interesting point about accessibility. So we're going to be talking about people who, need text or alt text, but generally when we talk about scientific illustrations or visual communication, we focus on how to make the visuals most accessible, because usually it's kind of the other way around, where text is available, but visuals are not, when we talk about knowledge translation or scientific communication. So in our experience, it's like trying to push more like classical means of communication into something that's visual. We don't often find the challenge to go the other way around, where text is usually widely available in that. Yeah, so this is how Designs That Sell was born. I kind of combined a bunch of different experiences that I had and a passion for visual science communication. And I put this up here because I know that I speak to a lot of scientists or individuals who might have passions and interests, and I just want to let you guys know that you don't need to be an expert in business or an expert in a particular area to start a company or to kind of invest in yourself and invest in your passion. So hopefully it's a little bit inspirational, but we're going to talk a little bit about Designs That Sell over the years. So in 2017, I founded this company. Really, it just started mostly as kind of like a freelance project for myself. And I just worked on scientific illustration for publications and thesis. So specifically, even within, a field of cancer. And then in 2018, we started getting more requests and our team grew. So a few different really talented individuals joined on and we started expanding what we were able to offer. And so we focused on things like infographics and educational material. And obviously with that expansion, it required a little bit more research into some of the strategies. So when we talk about infographics, Natasha is going to be, again, giving some examples and she can answer those questions a little bit more effectively as well. And then in 2019, we expanded our services even further to content creation and branding packages, as well as we expanded our team and we included individuals from the US as well. So now our team consists of individuals across North America. And then most recently in 2020, last year, we started to incorporate things like grant figure reviews, abstract and poster reviews to kind of allow for more affordable options for people who wanted to have actionable changes that couldn't maybe afford for, a custom illustration to be made. And most importantly, we also incorporated our own scientific communication research. So a lot of what you're going to be seeing today and a lot of what we're presenting is the result of our own individual research that we've done as a company. And hopefully, this will inspire you to kind of think about these things as you're putting together abstracts or publications, to think about how important it is to be presenting this information in a visual way that's strategic and a little bit thought through. So going into this, we're going to talk about a few different steps. So these are the steps that I'm going to talk about, and there's a lot of details here. There's a lot of information that's going to be coming at you. But like Julia said, this is going to be available. Sorry, my dog is now scratching on my bed. This is the beauty of working from home. I have 2 puppies and I was hoping that they would be good. Yeah, so I apologize about that if you hear some scratching. But yeah, so this is an article that we actually put out in the BMJ. And like I said, we're going to be providing a lot of information, but you can go to this article. If you don't have access, please let me know. I'd be happy to send it out to you. We're going to be going into detail, but if you have follow-up questions, if you have additional resources, definitely feel free to post those in the chat as well. And hopefully people can use those resources as well. So starting off, getting right into it, the first kind of thing that you want to think about when you're creating a scientific illustration, a scientific visual communication strategy is figuring out why you're doing what you're doing. So when we talk about knowledge translation, some examples of this might be awareness or advocacy. For example, I've seen a lot of things recently trying to encourage people to get vaccinated. And so there's a lot of, infographics and visuals that are coming out explaining how an mRNA vaccine works and helping kind of advocate for people to actually get those vaccinations. Healthcare itself, as well as disseminating scientific findings. But you always want to make sure that you're answering the question for somebody to engage with this or engage with what you're putting out there is, why do they care about that? And you want to make sure that you're addressing that. So that's your first step. And then we'll move on into thinking about some other factors, Natasha. So something that's really important and should also kind of frame the rest of the decisions and the steps that we're talking about is identifying who your intended audience is. And, you want to think about who's going to be engaging with this if you can. And you want to keep that in mind essentially throughout all the other steps that we're talking about. So almost putting yourself in that individual shoes, and even better if you can work with somebody who is your intended audience, then that makes your life a little bit easier because you don't have to imagine it and you can simply ask them. So think about who your illustration or your communication is going to be interpreted by, considering the individuals and what experience they have. A really good kind of thing that we do at Designs That Sell is we always leave opportunity for people to add additional content. Or, for example, also taking out content. So if, you're taking something that you're presenting at a scientific conference and you know that you're going to be using it for a lay audience, then making it so that you can remove some of the more complex concepts or, acronyms to make it so that people in a lay audience would be able to understand. And obviously, if you're communicating with somebody within your field or outside your field, that's going to change also what acronyms you're comfortable using or you should be using. So these are all things to consider when you're thinking about your intended audience. Useful tips for when you're communicating with lay audiences or the general population, which is usually something that you'll be working with when we're talking about knowledge translation, is to help people quickly understand the context of what they're looking at, is to actually put them in a setting that they're familiar with. So if you're talking about a healthcare setting, putting in a waiting room, putting in somebody who looks like a physician or something that familiarizes them. If you're talking about education, maybe illustrating or putting them within a setting of a school, talking at at-home individuals a living room. And when you're also doing these things, you want to think about what's the easiest way, the simplest way to communicate where they are or the context. So you want to avoid, forcing anyone who's looking at your illustration to make inferences. So you don't want to be putting in complex, convoluted symbols or pictograms. If you want to show somebody stopping something, a stop sign is, a little bit better there. So there's lots of good comments in here as well. Including people from your audience is a great approach. Yeah, definitely. And we have some examples actually where we talk about why it's really key, and how they can bring in some things that you might not think about there. Okay, and so this is another example of an infographic. This is an educational intended infographic. So this was done for one of our summer internships last year, created by Jen and illustrated by one of our talented organic chemists on the team. And this is for organic chemistry classes. You don't need to understand a lot of this, but the idea is that the targeted audience was those who are in organic chemistry currently. And so, they had those backgrounds, being able to identify those different acronyms and things. But then we also translated, a complex concept, which is this SN2 reaction underneath in the Let Jane Explain section, where we have a scientist literally catching and throwing balls to explain how this process works. And so, you could take something that's really complicated that might be a complex concept and turn it into something that people can understand and manage within their minds. But of course, you have to do that within the context of the audience that you're talking about. So here, undergraduate students that are in organic chemistry. Okay, and the next step that you're going to have to do is to identify a platform. So I wanted to talk about, the variety of things that are available for people who want to go in and create a scientific illustration or a visual. And there are essentially, a variety. I've only included like a small tidbit of what's available into what I think are like the more common and useful apps. But when we're talking about them, usually when you talk about complexity and skill that's required, that mirrors customizability. So what I mean by that is usually the apps that are more simple to use function on drag and drop kind of platforms. So you're going from a set of objects, illustrations, pictograms, icons, and then as you get more complex or more skill is required, you go into things that are more vector based, meaning that you're having to use and identify your own objects. So that's where illustration and custom illustration comes from. But there are benefits to both. And I speak with a lot of graduate students who have spent a lot of time, trying to learn Adobe Illustrator. And really, that's not the best use of time in graduate school. So it's not to say that one method is better than another. It's just something to think about. But if you're trying to get a point across, you can do the exact same thing and have an effective visual created in Pictochart, Bengage, or Canva, as well as somebody who can, custom create those elements in Adobe Illustrator. It's just, concerns around copyright that you need to think about there. There are tons of free resources available that we will also identify near the end of the presentation for you. And our next step that we like to talk about is picking the takeaways. So obviously this is going to be very different depending on what you're trying to communicate. But when we talk about scientific or research communication, I like to try to push individuals that are our clients to come up with the 3 main points or a main results title. So if you had to create 3 sentences of priorities that you want to communicate to your audience, what would those be? And when we're thinking about communicating with, knowledge translation with lay audiences, or communicating research that's complex and simplifying it, or if you want to, again, focus on that advocacy point or awareness point, you want to make sure that the points that you're coming across are always action oriented. So what can that individual do to follow along or to understand the research that you're putting forward? Or for example, if you're talking about awareness about, wearing masks, you want to have those things be outlined, bolded, and very clear. You want them to be simple, and you want to try to avoid using paragraphs when you can. Sometimes we have an exception where if you're giving background information that somebody might be more interested in learning about, then you can use an introductory paragraph there. And that's specifically, again, within the context of infographics. And an example of this, so this was one of the infographics that was made by one of our very talented illustrators, Naomi. And this is the plight of the pangolin. And really, she was just talking about the endangered species. But there's a lot of information here, as much as you would expect in a scientific review article. And the way that is broken up and organized allows you to go into the areas that are most interested to you. So this was created specifically for kind of like a print print or an electronic version of this information. So obviously, just looking from a very far away perspective, there is a lot of, small text and font and things, but it's really for somebody to dig in and to go and look at the different components and read more into it. And what we're highlighting here is that, we're specifically talking to an audience. So if the audience knows a lot about this, then we inform and we put in acronyms. If we're talking to an audience that doesn't really know a lot about it and we want to raise awareness, then we want to make sure we are highlighting the important things, like in the title, the world's most trafficked animals. So she wanted to highlight that and kind of set the tone for the rest of the infographic there as well. And just as an example of how you can like highlight things properly, we're going to have some illustrations that are done well and some illustrations that are not done well, or communication visuals. So when we talk about science, a lot of us probably remember from biology the central dogma of biology, going from DNA to RNA to proteins, and the main concepts that you want to be highlighting here. On the left, what you see is a very old illustration from a publication explaining this process or highlighting this process. And on the right, you see something that's more modern that was recently used in a textbook. And what you can see is that there are ways to highlight different components and to emphasize different regions, but the main points, for example, on the left are not as clear as the main points on the right, where you've identified your objects on the left and the processes in the middle. Whereas on the left, everything's kind of merged together and it's not really clear what we're highlighting here in that process. Yeah, and this is again a resource for you here. There's a textbook, Teaching Patients with Low Literacy Skills, that we like to refer to quite frequently. Has some really good considerations for talking to individuals, but we also like to test our infographics or the knowledge translation tools that we create. So when we're creating visuals, obviously, we try to stay away from text as much as we can, but sometimes it's necessary. And when we're using text, we want to make sure that it's at an appropriate reading level. So the rule of thumb for Canada for a reading level that would be accessible by the general population is about grade 5. Which can sometimes be surprising because, we like to think that we're educated and people are literate, but, we want to make sure to include everyone that it is testing at a grade 5 reading level. So I always recommend throwing your text into the Smog Index, which is a simple measure of gobbledygook. It is a scientifically validated measure, even though it sounds kind of ridiculous, it's really useful. And they'll give you a reading level and some suggestions on words that, are a little bit more complex. And it might just be a matter of throwing that into a synonym, search engine to identify a word that's more accessible. And then our next step that we want to think about is organizing. So once you have all the content, the goal, the information that you want to put there, I always recommend just organizing a layout of what information is going to go where. And this is really important for communication because we want someone to be able to know where to start and where to end up. And so we want to have a plan when we're going into visuals or infographics and not just, randomly start. You typically see titles at the top. In English and in our culture, we usually go left to right, top to bottom. It's not the same in all cultures, so just being aware of that. But things like that need to be thought about because it will help people understand and pick up the content a lot more quicker if their brain can process something that's organized and thought through. Another thing to think about is what the main point of what you're trying to put out with. If it's like an action item that's going to be focused on advocacy, then maybe that's the central focus and maybe that's what you want the main takeaway to be. So there's different ways that you can organize. Some of the, obvious ways that we think about in science is using headings. So, when we talk about introduction, methods, results, discussion, things like that. You can use arrows, but obviously, I've seen some overuse of arrows. If you're using more than 10 arrows, really think about why you're using the arrows. Numbering is another great strategy. You can use color. So doing something like a color gradient, which is really accessible for those who are colorblind as well. Like if you have a gradient, they can still understand that. And then also thinking about white space. So people like to, put as much as they can into a visual or into an illustration, but sometimes less is really more and can help, help somebody walk through. So think about adding some white space in to separate different concepts and help with your organization. And we'll give some examples of that here. So this is one example of, this is from the same textbook and it's showing very similar processes. So for those of you who are cell biology focused, this is essentially a process of cells eating and spitting out things. And so you have an endocytosis and exocytosis process. On the left, what you see is what I would call a classic overuse of arrows, as well as a lack of organization and flow. They've lettered things here, but it's not really clear where to start or where to go. Whereas on the right, in the same textbook, illustrating something very similar, you do have that flow. So it kind of shows you how much easier it is to understand a concept and work through, illustrated information, regardless of what it is, when you have things like numbers guiding you through, or a general layout where you're able to move through a visual and you understand where you're starting and where you're ending up. And another thing that I wanted to highlight is some of the visual communication that's done during COVID. Obviously, we've seen a lot of different resources brought up. This is done by my friend Avesta, and it was translated to something like 54 languages and highlighted on CBC. So she's also an illustrator. She works for a company though, so she doesn't really do freelance projects, unfortunately, but she did this as a side project to help inform and educate, and it was wildly successful and went viral quite quickly. And this was done early on in the COVID-19 pandemic, but there are a few things that I like to highlight about this. First of all, the action-oriented things she shifted and put on the right in a different color. And that highlights again, like where people want to go if they want to be, creating some kind of a plan for themselves. And on the left, you have all the information, and she's used some really good strategies. So she's used color very well, where you see from the top of the healthy lung or alveoli going down to a severely infected alveoli, the color gradient that's been used there is also used in this immune response in the bottom right there. Now thinking about something like this, it's beautiful and we see the end product, but a lot of work goes into it. So for her, she kind of provided some insight on Twitter about, how much work went into this one simple visual. And what you'll notice is that she's doing a lot of the same things that we recommend doing. So she highlights the key points. What is it? How it transmit? Why does this matter? So again, she's answering the question of why do people care about this right in her infographic, but she's also strategizing what the different components are that she's going to use and where she's going to lay them out. So this is another, another point emphasizing why you want to organize information and what you're putting out. And that's the end of my section of this talk. Natasha is going to pick up where I left off and give you some more examples, specifically through the KT lens as well. But I have my contact information there. I'm happy to connect on Twitter. I'm happy to connect by email, and I look forward to any questions, and I'll be back at the end to answer them. But thank you again for listening, and thank you for joining online. I know there's a lot of options for webinars to join lately, so thanks for choosing ours. And I'll pass it over to Natasha, who is my very talented coworker that's going to blow you away as well.
Great, thanks so much, Sarah. So yeah, I'll just be picking up right where Sarah left off. And moving into, I guess, talking in more detail about the different components of science illustration. So we at Design That Sell kind of refer to these as the ABCDs of the layout and composition. And I'll be speaking about each of them on the following slides, but also wanted to note that these things all kind of depend on the kind of data. Sorry, would you mind muting who's ever in the background? Great, thank you. So yeah, just definitely consider what kind of data that you're going to be showing if you are showing data. So examples of pretty common formats are if you are showing how something is changing over time. Timeline is a very familiar kind of tool for this. Or if you're trying to show how something changes in maybe, it's an environmental carcinogen and you're trying to show how it is different at different places across Canada, great to use a map for that. All right, so moving then into the ABCDs. So A stands for alignment. So keeping things within the same line or the same plane. And all of those platforms and software that Sarah highlighted earlier, all of these have inbuilt alignment tools. So, probably back in the day, you would have used a ruler and tried to align things, but luckily that's all taken care of with these digital tools. And just to highlight, as you might have gathered so far, we do like to show visual illustrations to kind of have a more practical example of what we're speaking about. So here for alignment, we have two illustrations of hematopoiesis, or the formation of blood cells. And they're showing the exact same information, but you can see that the illustration on the left, the things aren't horizontally aligned, which makes it a bit harder to follow. So for instance, if you're quickly looking, okay, after 3 rounds of cell division, what are the products? It's more difficult to see like the end result of that on the left versus on the right where everything is nicely horizontally aligned. So because of that, that would be my preference out of these two illustrations. Moving on, B stands for balance. This is, I guess, a bit harder to explain, but do have a visual example for this. So this is essentially limiting proximity and considering the white or negative space in the illustration to make the illustration or infographic look easier to read, because you don't want it to look very overwhelming to the reader, because that could make someone not want to even take a look at what you're presenting to them. So yeah, it's great to use kind of white or negative space to help separate the different concepts in your illustration. So again, here is an example. So two depictions of photosynthesis. And my preference is the one on the left, because you can see that it does look less overwhelming towards the reader. It's a bit more simple, whereas on the right, there's more things happening. And, you know, there's like that squiggly arrow near the sunlight. I would like argue it doesn't really do anything besides just take up that white space. So again, definitely a great thing to consider when you're creating your own illustrations. C stands for contrast here. And when I say contrast, I'm not speaking only of color contrast, but also how the different points are differentiated within your illustration or infographic. So definitely you can use color to do this, but also great to use bolding or even different fonts, as well as using boxes or circles around different objects to help emphasize the key points. So to illustrate this, here are two visual depictions of the nitrogen cycle. And you can see that in the illustration on the right, there's really no ways of differentiating the information from each other, which makes it like, again, if you're just glancing at this and want to see the key takeaways, it's harder to discern quickly. Whereas the illustration on the left, you can see that the arrows are highlighted in red, and then all the key components of the cycle are circled in that white circle. So that, I think, I would argue, is more effective for a reader who's trying to just start off with this and learn what the nitrogen cycle is all about. So again, the one on the left would be my preference here. Okay, finally, D, we have that stand for duplicate. And that means aiming for internal consistency in your illustration or infographic, because you want to have one kind of style or look throughout the whole piece. This includes, you know, color schemes, typography, the methods of contrast, and the methods of hierarchy. So how you're differentiating your different points in your piece. And this allows readers to really focus on your science and your message, rather than trying to determine why, you know, the color scheme it started off as pastels and then it moved into black and white. Like, that's not the main message of your piece, right? So you don't want that to take up a reader's cognitive space. All right, so again, an example here. So we have, if you remember, I think this is like grade 10 content in Ontario. So this is showing an overview of the cell cycle. And while the illustration on the left, it might at first glance look more visually appealing, I would argue that it's not as effective because we have a lot more colors, kind of a rainbow happening, and then there's a 3D moment also going on. Whereas, you know, if you're a student and you're trying to take away, you know, you have a science test and you want to take away, okay, what's happening to the chromosomes at each stage of the cell cycle? I would think that the illustration on the right would be a better learning tool for you, because it's clearer and you can really, the colors that were used, you can really easily follow the movement of the chromosomes throughout the different stages of the cell cycle. So again, that would be my preference. So speaking in a bit more depth about colors, so colors can be an extremely useful tool when used properly. Something to note is if you can't use color, for instance, often, or maybe sometimes journals have a higher fee for color images compared to black and white, then shading works exactly the same way and is also helpful for accessibility purposes. So essentially, we recommend keeping things physiologically sensible when possible. So, you know, don't try and reinvent the wheel and make blood red if it's oxygenated, blue if it's deoxygenated. Because there are actually consequences of using confusing or misleading colors, including the introduction of bias. So again, keep it simple. Don't try and challenge the norms. Typically, you know, if something's increasing, green is a great color for that. Whereas if it's decreasing, then red is effective. So here again, another example showing two illustrations of the structure of an artery. So you can see the one on the right uses a simpler color scheme. Again, just the red for the oxygenated blood versus blue for deoxygenated. Whereas if you're looking at the illustration on the left, the colors, I would argue, don't really add much or anything. And they might also be a source of confusion if you're trying to learn about this. Like, why is it that the internal elastic lamina is that like pinky purpley color? Is that reflective of anything like of note? Or is that just an artistic choice? If you're unfamiliar with the concept, you actually wouldn't know. So it may lead to some confusion. So again, the simpler color scheme here would be my preference. Just an accessibility note for choosing colors. Always consider combining colors with patterns, textures, or shapes, especially if you're presenting data, because you do want to avoid, you want to ensure that whatever your message is accessible for people with color blindness. So here, you know, we've listed some color schemes here to avoid. So you don't want to, you know, if you're trying to show and compare and contrast data, you don't want to present some of the data in blue and then some of the data in purple, because people with color blindness might not be able to differentiate between the two. So here's a great resource that many people on our team use, and I would highly recommend. It's Coolors. It's a free online, super fast color schemes generator. Feel free to take a look at it later. We have the QR code here as well. Something else that I wanted to note, again with an example. So this is an infographic done by our last year summer intern Abdullah and illustrated by our team member Molly. So sometimes keeping it simple can be just as effective as, you know, having, you know, spending hours choosing 5 different colors. So here you can see that there's only really 2 colors used. We have different shades of blue, and then we have this reddish color for highlight. And because the topic of this infographic is about iron supplementation, we decided to, you know, again, keep it simple and use that kind of deep red color to signify the iron. So you can see that highlighted throughout. So again, just emphasizing that, you know, you don't need to have 10 amazing colors. Sometimes just working with 2 shades can be very effective. All right, so moving on to typography. So this might be probably more relevant for posters, infographics, etc. So the font that you used actually has a large impact on how your visual is perceived. And there are 2 main general categories of fonts. So sans serif, such as Arials, these have a more modern feel and are typically easier to read. Whereas serifs, the serifs are actually the small horizontal lines added to the tops and the bottoms of letters. And these have a more classic and traditional feel. So, you know, Times New Roman definitely has that old-fashioned kind of feel. And, you know, even something as small as the font that you choose has a large impact on how approachable your message can come across. So you can see here we have 2 scientific posters, and just at first glance, the one on the left is using a sans serif font, so it comes across as more approachable and more modern, versus the one on the right has the serif font and has a more classic and traditional feel. As well, it's also too important to consider the typographic efficiency. And this refers to 2 components. First is legibility, so the ease at which a word is recognized. And secondly, readability, the ease at which a text can be understood. And generally speaking, it's better to use sans serifs because they have a higher typographic efficiency, although the exception is in very small font sizes, which is why if you're looking at a print novel, the text is likely to be in a serif font. But I would generally, our team does stick to sans serifs because again, just easier to read and definitely has a more approachable modern feel. And a great font resource, again, I would highly recommend Google Fonts. There's a very large selection of free fonts that can be used for personal and commercial purposes, which is great. Okay, then speaking about labels, it's important to label only what needs to be labeled. You know, you don't need to label everything in your illustration, but you also want to make sure that everyone has the necessary information to understand what you're talking about. Try and keep one orientation for all of your labels, so horizontal, vertical, or at a 45-degree angle. Keep all lines, line thicknesses the same, and make sure that all your labels are aligned properly. Try to have your lines not cross if possible. If it is unavoidable, we'd suggest using different colors for those labels. All right, so we're approaching the end here. So again, for your shapes, illustrations, and images, you want to provide the detail that is required and nothing more. And like Sarah mentioned earlier, you don't want to be using really abstract images and pictures, because again, that means that the reader is devoting cognitive space to determining the message of a really abstract concept. And for data, keep it simple and don't embellish. So here is an example of a pie chart, and whoever created this decided to really go for it in terms of the artistic capabilities. So they, added a few different colors, made it 3D, but unfortunately the end result is it's really hard to glean like the message, right? So you actually have to look at the numbers for each of those components because you can't tell from the graph. So again, keep it simple for charts and presenting data. So as you can tell from our presentation, we love presenting free resources. So the Servier Medical Art, there's some great vector images there for all things medical and cell biology related. And BioRender is also a popular kind of drag and drop illustration platform for scientists. If you're looking for actual pictures, then the Public Health Image Library from the US Centers for Disease Control and Prevention also has some great freely accessible pictures for you to use. And then whenever you're creating this, you always want to be considering where can you simplify everything that's presented, both the text and the illustration, because you don't want your readers looking like this poor person and being very confused. So an example of this, this was a project by our summer intern, Sean, last summer, illustrated by Naomi. And this infographic is intended for service users in alcohol rehabilitation settings. And what we're trying to explain here is actually a very complex, it's the Mayer's relapse prevention principle. Oh, sorry, it's not Mayer's, that's the coherence principle. It's Marlat's relapse prevention principle. But you'll notice that we don't say that anywhere in the illustration because we try to really remove all unnecessary words and details and only communicate what the intended reader needs to understand for this. So you can see we kept it very simple with the wording and didn't include any of those, scientific information because it's not necessary for our purposes. And finally, we spoke about this a bit before, but it's really insightful to pilot test whatever your infographic or visual is with a member or multiple members of your intended audience. So this is a key step, not just a checkbox, because you can get really meaningful and purposeful feedback from this. It's even better to co-create the materials kind of from the beginning. But we understand this isn't always possible due to time and financial constraints. So an example, so this is a project that I worked on alongside our illustrator Molly for a client at Simon Fraser University. And this was an infographic for healthcare providers about how to respond to anxiety among people accessing sexual health care. So we created this infographic and we presented it to 15 healthcare providers and asked them, what do you think? Do you have any suggestions? And we actually got some really insightful feedback. So the first thing that was mentioned was regarding the text. So the healthcare providers highlighted that using the word client reinforces an existing power structure between the person accessing services and the healthcare provider, and that's not beneficial, right? So in the final version of the resource, which is on the right here, there's actually the word client is not used. Something else to note for the illustrations, you might notice that the healthcare provider is no longer wearing a white coat. And again, that was because of it reinforces that existing power structure and power difference between the person accessing the services and the healthcare provider. And at first I was a bit like, okay, so that's the white coat is a really common signifier of a healthcare provider. So what can we do instead? But then we, brainstormed a bit and came up with the clipboard and the name tag. So still signifies that they're, working at wherever, like the clinic or the hospital, but tries to challenge that pre-existing power structure. So we did it. We're finally at the end. So thanks again for joining us today. I also want to highlight we are hosting an event next week that's going to be specific to creating scientific posters and presenting them in a virtual setting. So have listed the QR code here, also all the event details on our website. So would love to see you there if that's of interest to you. And yeah, would love to connect with you further. My email is listed here. So again, thank you so much for joining us today. Thanks as well to Julia for organizing this. It's been incredible, and we thank you for all your hard work alongside everyone at the Maritimes for support unit. So with that, I will stop sharing my screen, and I haven't been monitoring the chat, but we'll take a look at that now. And if you have questions, comments, would love to hear them.
Great. Thank you so much, Sarah and Natasha. That was an amazing presentation. And as you can see, when you look in the chat box, there's a lot of chatter commenting on your guys' work and the resources that you provided. So we do have some time for some Q&A. And if you haven't been to a Keeping Up with KT webinar before, what we do is Sarah and Natasha are going to come on the line, and you have the opportunity to either just write your name in the chat box, and then you can put on your mic and ask your question out loud, or you can just type your question in the chat box and I can read it out for you. So whatever you feel comfortable with, just make sure that you turn off your microphone when you're done, and we can get started. So if anybody has any questions, just please, again, write them in the chat box or write your name.
See a few questions about the poster session. Great that people are interested. So yeah, Sarah has put a link to our website. It's just designsthatsell.ca, and all the details are on there. It's also free to register.
So Christy asked, do you have a particular go-to resources that you used when first starting?
Good question. I would say for me, it depends on the project and also what the client is looking for. So for instance, sometimes clients approach us and they say, hey, here's my paper. I want an infographic. Can we get started? And in that situation, I would, take a thorough read of the paper and see what the main messages were, and, write those down, think about how to display them, and then confirm with the client, these are what I took away as the main messages. Are these in line with what you want to highlight? So that would be kind of the first step for a project like that. Whereas sometimes clients approach us and say, okay, I've done everything that I want to share in PowerPoint, but it's like not how I want it to look. So can you take what I have in PowerPoint and then just, I don't want to say make it prettier, but make it look a bit more polished. So in that case, I would start with, kind of looking at layout, color, style. because that first stage of determining what information should be communicated is already finished. So yeah, I would say my process definitely depends on where I'm starting from. Sarah, anything to add there?
No, pretty much the same. It really depends. Sometimes if I have like inspiration, I'll start with the illustrations and things and kind of mix up my steps. But I would suggest, if you're getting started on this and you want to follow something that seems logical, I would follow those steps that we did go through today. And I did post in the chat, but Julie, I'm happy to provide the PDF to this if you're able to disseminate it to whoever registered as well.
Great, thank you, Sarah. So I'm just working down the chat list here. So Jennifer P asked, how do you partner with individuals trained in communications and design?
So, I mean, we are individuals trained in communication and design, so we don't, have as much difficulty with that, but there are resources that are available. So I know, what's that app, Natasha? It's like Lifeology.
Oh, Lifeology, yeah.
Yeah, so that can, connect you directly with scientific illustrators. Obviously, we're always happy to work with individuals in research, the clinic, or knowledge translation. So our team specifically, we have individuals who are trained in science from a variety of different backgrounds. So for example, I'm like classically trained in painting. So I bring that to my design lens. Natasha, through her MPH, really focused on KT work, so knowledge translation work. So she brings that. And we have some individuals who are more illustrators than communicators. We also have some individuals who are more communicators than illustrators. So we usually try to pair people up when creating projects. That way you have that insight from both individuals. Is there anything else other than Lifeology, Natasha, that provides that service though?
That's I think the one that comes to my mind. I'm not sure if there's anything else.
Great, thank you. So Alina is next and says, thanks for the presentation, very interesting. Curious if you use readability, formula and assessment, or any other health literacy related elements when designing these knowledge products?
Yeah, that's a great question. That's definitely part of our process. But again, it does depend on the intended audience. So if you remember, Sarah shared an educational resource about the details of second year organic chemistry SN2 reactions. So for something like that, we are not going to put it through a readability kind of index or any kind of jargon checker, because I'm sure it would have a lot of red flags. But for something that is meant for a larger lay audience, we would definitely put that through the Smog checker that we shared, or I also like to use, there's an online jargon, scientific jargon checker. So yeah, it's definitely part of our process, again, if that's who the intended audience is.
Yeah, I would say if it's directly for health content, then we like to partner with patients. That's our go-to when we know that it's going to a specific audience, because there's a lot of validated health literacy tests out there, but nothing really compares to directly pilot testing with the actual intended clients or patients or audience.
Great, thank you, Sarah. And Jeanette was asking again about resources. So I did want to say that they agreed to share their PDF slides and the recording. So you'll be able to get all that information after. Does anybody have, I don't know if you want to add on to that, Natasha and Sarah, before I ask any more questions?
We should probably work on an online resource center, but that's a project on the side, because Designs That Sell is a part-time job for both of us. So it's slowly coming, but we are thinking about putting out some more resources specifically for things like graphical abstracts. So stay tuned, sign up for our newsletter. That way you keep in the loop, because we're putting things together. It just takes us a little longer than some people who work full-time on these things.
Do you provide this service to other students? Reza asks.
Yeah, great question. So as many of us are students, or I recently graduated, but I still feel like a student. So I don't know, but most of our team is graduate and undergraduate students, and we are dedicated to supporting students. So we definitely provide this service to students who are working on KT projects or looking for some advice or feedback. We do have kind of a graduated pricing scheme where, you know, you're a student, we're not going to charge you the same thing that we charge for a professor who's drawing from, you know, a $600,000 grant. So we do want to make our services accessible to students in terms of pricing.
Yeah, I'll just add, like, we're always happy to work within a budget. You know, we'll be flexible in terms of we can work on something that's more collaborative. And we do offer student pricing where you don't pay overhead at all. So you're essentially paying for the work directly because we are students. So we empathize with that if you're paying for your own. But we can also help you advocate for yourself as well as your science. If you want to talk to your PI and you're figuring out a way to do that, like, we're happy to help you do that.
Thanks, guys. I love all the questions coming in. Keep them coming. Kate is up next. I know something I struggle with is the impulse to fill all the white space. I'm with you on that, Kate. In your process, how do you work through paring it down when the design ends up too busy or too content heavy?
Yeah, that's a great question. Sometimes I find, you know, I like have finished the first draft of something, and then it's helpful for me to take a step back and be like, okay, like if I just saw this, what would I think? And I think this is where, you know, asking members of your team, asking intended audience in this work from home age, sometimes I'll just ask my mom, I'll be like, Mom, quickly, what's your first impression of this? Because sometimes it's easy. I feel like when you're like really deep in a project, you know, you've been working on it for 4 or 5 hours, it's easy to like not be able to take that step back. So that's something that I typically do when I'm working specifically, I would say for infographics, because I feel like that's where it's easy to be like content, and you don't want to go too far with that.
Yeah, and I'll add that, you know, there's always a really simple way to test if something's necessary or not by just taking it out and then seeing if people, you know, can still understand the message. So if you're not sure, try pilot test. We always like to focus on that as, you know, illustrations and visual communication are never finished. It's kind of like research is a very iterative process. So, you know, just being open to having it revised and change is something good. And if that includes testing, you know, the removal of some components, that might be a good way to kind of make your content less busy.
Yeah, that's a great point. And I will also add to that in terms of the iterative process. So the last example that I shared of the resource for the healthcare provider. So we started actually with 3 different versions of that. One did not have the little characters talking. It was just like, here's what you do. And then the third version was actually more of a, I guess, kind of abstract illustration. It was a roadmap with like the people along the different stages. And we actually went to the healthcare providers with all 3 to see what they preferred. So, you know, that process, it took longer than I was expecting, even for me, just because, again, it was like, okay, we like this part of the, you know, roadmap, but not this part. And my overall preference is the like speech bubbles. So yeah, I think when you're working, especially if you are partnering with the end users or they're helping co-create the materials, just being open to, you know, this will not be a, okay, I did the draft, it's ready, let's submit it. It's definitely a process. And I think that some people as well who aren't as familiar with that may not appreciate that, you know, so you're like, okay, I've been working on this for like 10 hours and they're like, what? Like, I thought it would have taken 2. And it's like, well, you know, the edits that you asked me to complete were pretty complex edits. I had to like redraw this thing and like change the whole layout. So just being aware of that. And if, you know, you're working with anyone like a client, just being prepared to say, actually, like these edits are complex and will take a while. I think that's important.
Absolutely. If no one has any more questions or I think about them, I may add in a little question for myself here. Do you guys have any recommendations when doing that iterative process? I do find it also does take a long time, that especially because it's supposed to be the KT part of it, it's like, okay, let's get this done in a timely manner. And then it ends up taking maybe even longer than writing a publication itself, because it's kind of a new way to approach the work. So do you guys have any boundaries that you put in place or kind of tips to help with that collaborative process? Though it is so amazing, we all know that it can take a bit more time than usual, kind of heads down and do the work.
Yeah, that's a great question. I think asking specific questions about what you want. So instead of like showing an infographic and saying, what do you think? Because that's a very broad question. Saying, you know, is this easy for you to read? Are there any words like that don't resonate with you? What do you think of the colors used? So asking those more specific questions can really help out. And that way you get more actionable feedback, as opposed to, you know, if you ask, what do you think? And someone's like, I don't love it. Kind of like, okay, how do you move forward with that? Right.
Yeah.
So I think that can help get more tailored and specific feedback.
Yeah. And like, I always like to think with those pointed questions that Natasha asks, you're not getting that, you know, symptom of too many cooks in the kitchen, because not everyone's going to like the same color scheme. We all have individual tastes. You know, not everyone's going to like something visually, but the focus is really like whether it's effective or not visually. So I think you want to be focusing on questions that talk about the content, that talk about how things are represented, and the text that you're being, you know, that you're strategically using, rather than, you know, do you like how this is illustrated, or do you like this color of it? Which is like, it's important. It's nice to have things look nice and have people like it, but it's really not, you know, the focus of what we do. We make pretty things, but that's, you know, something can be very beautiful and very ineffective at the same time.
Yeah.
Thank you, guys. I'm just going to give a moment for any last questions. And if not, I'll give you guys back a few minutes of your day. So if anybody has some last ones. Oh, I have one more. Go ahead, Kate. We have time.
Thanks so much. I'm just going to talk because I actually talk faster than I type. So in respect for everybody's time. This is a little off topic, but Sarah, you had mentioned that you'd come across some really good like vaccine hesitancy and vaccination information tools out there. And I guess I'm just wondering if off the top of your head, you know of any out there that are pretty good.
Yes, there's one that I've been really loving lately. It was somebody who I connected with on LinkedIn. Let me find it and I'll post the link, because they had an iterative process that went through LinkedIn. And it was essentially little cards about the different vaccines, and I like that one. But obviously it's a hot topic right now. If you hashtag infographics into Twitter, if you have access to Twitter or LinkedIn, you'll get a lot of them that are focused on vaccines right now.
Awesome. Thank you so much. And thank you both for an awesome presentation.
Oh, thank you for the compliment, and thank you for attending. I'll try to find that. I don't know if I can, but like I said, the one that I included of Vesta's illustration is really great, but that's obviously more focused towards like the immunity and disease progression. I have seen a few really good ones for vaccines, but I don't know if I'm going to be able to find them on demand.
Maybe,
you know what,
yeah,
maybe Twitter is always a great spot, right?
Yeah. Yeah, and maybe when we send these slides to Julia, Sarah, if you like have those tweets come to you, we can share those as well.
Yes, yeah. I think you know which ones I'm talking about, because we did talk about them in a junior illustrator session. But anyway, somebody will know where they are in our team.
Thank you. Appreciate that.
Great. Thank you guys again. There is so many compliments coming in about how important this work is. And you guys do such a good job of breaking it down, which I really appreciate it, especially for people with backgrounds in research. We really like, you know, the methodology and the process, understanding how to work through this. And I just love how easily you guys are able to break that down. I often reference your work when I am developing infographics. So again, thank you so much. We will have this recording up in about a week's time on the MSSU website. And we will also be sending out the slides for those that are interested, to those who attended. So if you have any last comments, Sarah and Natasha, please go ahead. If not, I will end the call, and I'll wait till everybody is off before signing off.
Yeah, I just want to thank everyone for attending again, and special thanks to you, Julia, for facilitating this. It was a great time.
Thank you so much, ladies.
Thank you.
Great.
Thank you, everyone. I found it also. So let me post it here as well. It's from La Pipette. He's another scientific illustrator. And he actually talks a little bit about the design and context of why these cards were developed and things. So yeah, anyway, there's free downloads as well as translations on there. So there it is.
That is amazing. Thank you.
Great. Thank you. Thank you guys so much. You can sign off when you're ready, unless you have any other questions. I just want to make sure that everybody gets off okay. But that was amazing. I know people have really appreciated that.
Bye, everyone. Have a good day.
Bye, everyone.